Hi, everyone. Thank you for joining the Colorado Coalition for the Homeless for the first session of our 2022 education series. I'm Alexis Whitham, Director of Communications for the Colorado Coalition for the Homeless. We really appreciate you being here tonight. Thank you so much. We here at CCH, our mission is to work collaboratively toward the prevention of homelessness and the creation of lasting solutions for families, children, and individuals who are experiencing or at risk of homelessness throughout Colorado. CCH advocates for and provides a continuum of housing and a variety of services to improve the health, well-being, and stability of those it serves. This is the first of 8 sessions this year in our education series. Each session welcomes community experts who focus on a specific topic related to homelessness. And we really appreciate you joining for tonight's session, Women in Homelessness, Causes, Supports, and Solutions. So Ryan, if you can go to the next slide. Thank you. And then head on to the next one. Thanks. So we just want to do a little housekeeping at the beginning of our session about how this is going to go. I know we're a couple years into Zoom, but always good to cover some of the basics. So for our agenda tonight, just want to let you know, we're going to start with a few minutes up front to provide some data around the reasons that women are uniquely at risk for experiencing homelessness and some of the statistics around that. Next, we'll have our panel discussion with some local experts, and that'll go for about 45 minutes. And then finally, around 6 p.m., we will welcome questions. The presentation, as you can tell, is in webinar format, which means that guests are not visible on camera or microphones. So when we head into the Q&A portion, please just enter questions using the Q&A button at the bottom of your screen. You can use the chat feature to connect with other attendees. And this session is being recorded, just want to let you know, and will be on YouTube tomorrow. You'll get a link in the follow-up email if you missed any of the session or you want to share it with someone else. And finally, I just want to let everyone know we're experiencing some technical issues with our automated captioning for this event, and we sincerely apologize that we're not able to make it fully accessible. We hope that when we put it on YouTube tomorrow and the automated caption show up, that'll help to fill this gap a little bit. And finally, if you're posting about this event, our handle is COCoalition on Twitter, Facebook, Instagram, LinkedIn, and we're using the hashtag CCH Ed Series for the event. All right, so I'm going to do little statistics on women in homelessness. So before we jump into the panel with the local experts, some of the root reasons that we want to talk about and just give a little bit of background on are poverty and wages, housing insecurity, housing and health, violence and exploitation, and then of course the impact of COVID-19. It's very hard to talk about what's happening without addressing some of the disproportionate ways that women have been impacted by COVID-19. So poverty and wages. Women are more likely to live in poverty across race, ethnicity, age, and ability when compared to their male counterparts. Ryan, if you could go to the next slide. Thank you. This is greater for women of color, and that includes 19% of Black women, 18.7% of Latinas, 18% of Native American women, and 8.7% of Asian American women. There's also other factors that are really relative. 14.3% of women born outside of the US live in poverty, and 27.5% of women with disabilities. We also see greater numbers for women over age 65, single mothers, and LGBTQ women. And those levels, when we say poverty, we want to make sure we know what that means. So that's just an income of $12,280 a year for an individual and $26,246 for a family of 4 with 2 children. In terms of wages, that's the leading cause of poverty for women. It's those inadequate wages. Women make 83.1% of men's wages. And some factors for this obviously include job choice and hours worked, but pretty much all researchers believe that discrimination and gender bias play a significant role. It can't all be attributed to those things. And interestingly, education does increase a woman's wages. So as a woman becomes more educated, she will make more money, but the gap between her and an educated man at the same level actually grows the further up you go. So next slide, Ryan, thank you. Housing insecurity. This is not going to be news to anyone here who lives in our beautiful state, but Colorado is one of the most expensive markets in our country for rental housing. The state is home to 162,557 extremely low income renter households, but has only 30 affordable and available rental homes per 100 of these households. Women are evicted 16% more than men are, And 60% of Black women renters are cost burdened, which means that they pay at least a third of their income on housing. They are also most likely to be the renter of record. So if they enter the cycle of homelessness, it's harder to get out of it because they're going to have that eviction on their record. Next, we'll talk about health. Thank you, Ryan. Appreciate it. So women are more likely than men to forego medical appointments due to cost. A study from the Kaiser Family Foundation found that 11% of Colorado women surveyed in 2020 reported going without healthcare services in the past year due to cost. Once again, these numbers are higher for most women of color, including 13% of Black women and 18% of Latinas. We also know that the average lifespan of a person experiencing homelessness is shorter by about 17.5 years than that for the general population. Here in Denver, we have a death count that we do every year for people experiencing homelessness. And if you look at the 2019 death review, the average age at the time of death for a woman in Denver who died that year was 47, just 47 years of age. And then in terms of mental health, being a woman with low socioeconomic status is associated with increased risk of depression. Women have twice the risk of depression as men, and women of color are at an even greater risk of depression. They're also statistically less likely to seek and maintain mental health services due to cost, competing priorities, inability to miss work, transportation, childcare challenges, etc. Next, Ryan, thanks. Around 50% of women report that domestic violence was the immediate cause of homelessness. The trauma associated with intimate partner violence, which often includes financial abuse and isolation from support system, puts women in a particularly vulnerable position on the streets. So even after escaping intimate partner violence, unhoused women are at risk of victimization and exploitation in the form of physical and sexual violence, as well as sex trafficking. The most recent statistics show that 32.3% of women experiencing homelessness report having experienced sexual or physical assault in the past year, and 64% of sex trafficking survivors reported being unhoused or experiencing unstable housing when recruited by their traffickers. And finally, just to talk a little bit about the COVID-19 impact, we all know that women were most likely to lose employment throughout the pandemic, and 1 out of 4 women who became unemployed during the pandemic reported the job loss was due to a lack of childcare, which is twice the rate of men surveyed. We also know that evictions are now rising in Colorado due to the end of the national eviction moratorium and the child tax credit ending, taking away some of that funding. So, we talked for a long time about how evictions were really going to rise because of COVID, and that has sort of been delayed, but now is when we're starting to see it because some of those supports are falling behind, even if there are still some supports here in Colorado, they're not being accessed necessarily, and it may not be enough. And so in December of 2021, landlords filed 3,237 eviction cases, which was the highest monthly amount since February of 2020. So next slide, Ryan, please. So we're working on an update to our Women in Homelessness issue brief. That's where we got these statistics. It will be available soon if you want to learn more about it. And so we know that this report is a lot of information, and it's a lot of really hard information. And so the report is one part of how we on the education and advocacy team work to talk about what's happening. And the other thing is this panel, which is about the solutions, right? And so everyone who's on our panel today, we're really excited about, because it's not going to be just about what women are experiencing and how they have come to experience homelessness or be in poverty. It's about what are we doing locally through amazing organizations and tried and true efforts that are really helping to reverse this and battle it and provide a little hope for our communities. So Ryan, if you can go to the next slide. I'm going to introduce our panel moderator today, my wonderful colleague, Aubrey Wilde. She is the Advocacy Program Director here at the Colorado Coalition for the Homeless, where she specializes in legislative and government affairs activities. She has a breadth of experience in Colorado's nonprofit sector, most recently as a Family Economic Security Program Associate at the Colorado Center on Law and Policy. She has worked with the State Services Division at the National Conference of State Legislatures. So welcome, Aubrey, and I'll let you introduce our wonderful panelists.
All right. Thank you so much for the introduction, Alexis. Thank you all, our audience, for being here, and panelists for joining us. We're really excited to hear from you. And I have the honor of introducing all of you tonight. First, we have Rebecca Martinez, Director of Emergency Shelter at the Gathering Place. Before transitioning to the nonprofit sector, Rebecca worked with the City of Denver for over 10 years, most recently in the role of Program Administrator with the Department of Housing Stability. And there she focused on the establishment and maintenance of Denver's non-congregate sheltering system. And her heart and passion really lie in re-envisioning our shelter systems with special attention paid to marginalized populations. And you can find Rebecca practicing intuitive energy work, curled up with a good book, chatting with a stranger, or spending time with her sister when she's not hard at work. And next we have Stephanie Miller, CEO of the Delores Project. Stephanie joined that team in April of 2019 with more than 2 decades of experience in leadership and clinical experience. And she previously served as the vice president and COO for a nonprofit HIV and AIDS organization that provides subsidized housing, support services, assisted living, case management, medical, mental health, and substance use treatment programs. The Delores Project provides inclusive 24/7 housing-focused shelter for women and transgender individuals experiencing homelessness, as well as supportive services for residents in the Delores apartments in Arroyo Village. And we'll certainly hear a lot more about what they do. And finally, we have Heaven Johnson, and she is the Domestic Violence Coordinator at the Colorado Coalition for the Homeless. And in this position, Heaven connects clients experiencing domestic violence to safe housing and services. She also serves as a case manager, helping families utilize housing vouchers. And before her time at CCH, Heaven worked in a variety of domestic violence programs, such as parenting time centers, safe houses, and working on legal advocacy. Heaven has a bachelor's degree in psychology from the University of Colorado, Denver, and is passionate about meeting the needs of community members through an intersectional lens. So thank you all so much for being here. And we can keep it pretty conversational. So if I ask a question that you'd like to speak to, feel free to jump in. You don't need to wait for me to call on you, but I might call on you. So let's go ahead and start by everyone talking a little bit more about what each of your respective organizations do and why you are an expert in the topic of women and homelessness. And just to kick it off, let's start with Heaven.
Cool. Well, I'm Heaven, and thank you for having me today. I'm excited to represent Colorado Coalition for the Homeless. Kind of like Alexis mentioned in the beginning, we do a lot of preventative work, working with families and individuals. A lot of my work is through case management and doing some of the domestic violence coordination with folks, so getting internal and external referrals of people experiencing domestic violence. But a lot of the work is just connecting with clients. You know, a lot of people are on different housing vouchers. A lot of folks are also unhoused, so trying to connect them to different housing resources and vouchers. I would consider us to be experts in that area. Just some of the programs that we have, the properties, people are eligible to stay there, so they can, you know, stay in the properties and then also receive those case management services to kind of stay out of that cycle or help prevent staying in that cycle of homelessness.
All right, how about Rebecca?
Thank you so much, Aubrey, for having me today. I am so excited to be here. The Gathering Place is really all about using positive relationships, hope, and resources to transform lives. So we've done this through a couple of different sheltering locations right now that we are working with. So one of those is our day drop-in shelter. And then we've also recently opened an emergency 24-hour shelter. So we're really excited to bring this type of model on board. But really the basics is we want to meet individuals who are experiencing housing instability or homelessness where they are in our community. And so I saw a couple questions come through in the chat. You know, are we going to speak to transgendered individuals, or non-binary. And that is something specifically that I think the Gathering Place really focuses on, is not only do we serve women who are experiencing, again, housing instability, but really those that identify across the spectrum. So we're not specific to one gender. Again, with our focus being on fostering those positive relationships and creating innovative ways to connect in our community, which I'm sure we'll go into detail about more in our questions to come. Oh, and then I should add too, didn't add this little blurb. I have been working in this field for about 12 years now. So various positions really that are connected into our sheltering system and world, be that from case management to program administrator to now director. So just have a wealth of knowledge from a city lens and a nonprofit lens as well.
Hi, thanks everybody for attending. And the Delores project has been around for about 22 years, providing inclusive shelter for women and transgender individuals experiencing homelessness. And we provide care through trauma-informed lens and strength-based perspectives. I would say that the experts really are the staff. The frontline staff who are there day in, day out, engaging with our shelter guests and supportive housing residents. They are what makes the Delores project, and they are the experts. I'm just the spokesperson. And I think some of them are on this call as well. Also, we shifted our shelter operations prior to the COVID pandemic. We were a week-long shelter. Overnight shelter, except on weekends, 24/7, but we shifted to 24/7 housing focused, fully embracing housing first philosophy, creating a whole new program called the Rehousing and Continued Care Program with 7 staff members who are providing rehousing, case management services, housing navigation, and continued care case management for those guests who transition from our shelter into housing. We continue to engage with them, do home visits for up to 1 year once they are in their apartments. So that's something that's been quite a game changer for us, and be able to get the support from our private foundations and host and city and government funding to be able to also provide short-term temporary rental support. And it's just heard one story recently of one of our shelter guests who had been evicted and had amassed well over 10,000, it might have been even 20,000 of debt that individual needed to pay off. But our case manager diligently worked with the property management and was able to get that reduced to a couple thousand, and we're able to pay for it. And so those kind of things are things that's happening that our staff is actively engaging with not only our guests and residents, but with the community and our partners to really get folks moved into housing as soon as possible and make sure that they remain housed.
Thank you so much, all 3 of you, for sharing that high-level view of what you do day to day. You do such important work, so we're glad to hear from you. And before we move on to our next question, Stephanie, I just noticed that you mentioned housing first. So for those of us who on the line who are not familiar with that term, would you mind explaining that briefly?
Sure. Housing first, very effective evidence-based practice where we are in shelter is one step into the process of getting rehoused. And so we are actively working with guests to get them into housing as quickly as possible. We work with them individually, and it's individualized care, but instead of housing ready, housing is the first intervention. Then thus we provide the ongoing care support systems once, during the transition, and once they're housed. So Housing First is the first intervention towards homelessness resolution and towards stability.
Thank you.
Anybody else have any other perspectives to add?
Yeah, I can jump in here a little bit. I think you summed it up pretty well there, Stephanie, but just to add it, like when you give someone a stable place to reside where they're not worrying about the day-to-day, you know, where do I put my belongings, or how am I going to get to this next appointment? When you give them that solid foundation to begin with, it allows them the opportunity to address the other barriers that they may be facing in their lives. So with that stability under them, you know, they can connect with the mental health supports, etc. But recognizing that's kind of our first step towards a healthy and connected space.
Great, thanks for expanding on that. I'm curious to hear from all of you about, in your opinion, what are some of the biggest differences experienced by women experiencing homelessness compared to men here in Colorado that you see with your clients?
I would say the biggest difference between men and women that we've seen is a lot of times women have children with them. So that kind of adds another element to their journey. You know, what does that look like for the kiddos and for them taking care of the kiddos? I think as far as domestic violence goes, a big thing would have to be just the risk of being housed versus unhoused, and how that plays into their safety. I feel like a lot of times people are having to women are having to choose, you know, to leave a unsafe situation and be unhoused, or to stay and to be housed. So those were kind of the two that I've noticed with women and working with them.
Would anyone else like to add to that?
I think women also experience oppression, gender inequity, and stigma, and that compounds their experience of homelessness. I saw on the Q&A, somebody mentioned about, well, is there any transgender data out there? And I believe Alexis at the beginning said that women are evicted 16% more than men. For transgender individuals, studies have shown that 1 in 10 transgender individuals report being evicted based on their gender expression. 1 in 5 reports being denied an apartment or home based on gender expression. And even seeking shelter, transgender individuals are at a significantly higher risk of being harassed and victimized, and that the violence and discrimination both contribute not only to their homelessness, but also their accessing appropriate shelter and appropriate housing.
To circle back a little bit, Aubrey, and I think one thing that I really wanted to drive home and share was a lot of it is about visibility. So I think when we think of our unsheltered neighbors, we often think of the man on the corner, who just may be more visible in our community. And I think a lot of that has to do with the safety aspect. So women don't feel as safe. They don't feel like they can openly be out in our community expressing this space because, they've already been victims of so many situations and don't feel comfortable being as vulnerable. And so that's a pretty big difference. It's, it's not that we don't have as many that are experiencing housing instability or houselessness, but really that they're hiding because they don't feel it as safe to be present in our community.
Thank you. I'd like to follow up on a couple of themes that you all brought up just now. First, Heaven, you talked about children. We know that when it comes women, services catered towards them tend to or sometimes include services for children. What are some of the successes and limitations of this model? And anyone can answer that, but I'll start with Heaven.
I would say something that's positive about that is the family can get support as a unit. For example, like through CCH, through our family support services, we have an early intervention outreach program. So we have a couple individuals who specifically work with families to, kind of accommodate the, birth to age 5, kind of filling in some of those areas that might need support, whether that's stuff related to school, applying for benefits, and then also to just education. But I would say one of the limitations to this is not every family is the same. Every family kind of experiences something different. There can be a family going through a CPS case versus a family that's not. Or if there's children within the family that have some type of disability or mental health disorder, those can kind of be more challenging to navigate through, since they're having to kind of connect with more organizations and service providers. So not every family is the same to kind of fit that one model of support.
I'll jump in here too and say that I think to your point, Heaven, I mean, that ability to address the family as a holistic unit, I think is really critical for their healing journey. And so us having them in the same space offers the chance to do that. And that's something we really value at the Gathering Place. One challenge though is, if we have a single mother who is experiencing housing instability, sometimes she doesn't have the opportunity for a break to focus on some of those other high level needs, maybe to gain that stability that she's seeking. So one thing that I'm super proud of that we have here at the Gathering Place is a play center where it actually allows mom to drop off kiddo and then to go engage in all of the services that are located here at our High Street location. So kind of trying to find that appropriate balance, right, between how do we provide this support for those in our community and give mom a break while addressing the family as a holistic unit. So one definitely bright side to it is yes, addressing that family as a whole, and then how do we be supported in that space.
I just noticed a question in the chat. Somebody asking, wondering where women experiencing homelessness might tend to go if they're not visibly out on the streets. We have shelter guests who have really lived out of their cars, their vehicles. And so that's quite often all their belongings and possessions, are with them in the vehicle, but they have to keep moving. We have a shelter parking lot, so some of the folks can just leave their vehicle there, but be able to come inside to a safe and warm shelter. But to piggyback off of the discussion about children, so our shelter is for unaccompanied women and transgender individuals. And there are times when our guests do not disclose if they have children. And it only pops up when they're about to get housing and would request a multi-room unit at that time. And so that is a need, I believe, in our community in terms of providing additional shelter and supports for families with young kids.
Thanks for tackling that question, everyone. Something else that has come up, which I found interesting, Rebecca, you touched on some stereotypes around what we might expect from people experiencing homelessness, what that might look like. So I'm wondering if folks would be able to share some myths around women experiencing homelessness or some stereotypes that we might think are true, but really aren't.
I will begin. Of course, that the face of homelessness could be any one of us. It could be any one of us. We have, I just asked my case managers how many of the individuals that they have on their caseload are employed. And roughly about 28% are employed. So they have jobs. They're educated. There's so many myths and stigmas related to what folks automatically assume. So yeah, the face of homelessness could be any one of us.
I'll echo Stephanie here and just say, I completely agree with all of those. I think one other thing we hear a lot is that it's their fault, right? Like, oh, this is your fault. If you worked harder, if you tried harder, if you did A, B, C, and D, you wouldn't be in this situation. And again, that's not true. It doesn't mean that these individuals are any less than us. It doesn't mean that they've tried any less than we have. It just means they're human, and sometimes we encounter situations in life that are out of our control. And so really wanting to just steer away from that narrative that it's anybody's fault, because that couldn't be further from the truth. We're all one day away from the other side of the table. And that's just, that's something I think has been a very common misconception in our community for those that we serve.
Thank you.
I was just going to say, Heaven mentioned this earlier in terms of, and I would say it's more because we're talking about self-reports. About 40% self-report that they have had a history of domestic violence. That is, in Heaven, you had mentioned that there are times when individuals have to choose between fleeing out of a violent partnership, relationship, or being homeless. And so that is another path towards homelessness that we see often.
Yeah, let's dig into the domestic violence and sexual violence piece a little bit more. And Heaven, I'd like to start with you. We know this is one of the biggest immediate causes of homelessness among women. Can you tell us a little bit more about how you work to ensure the safety of people who are trying to escape domestic violence?
Yeah, so as my role in the domestic violence coordinator, we get referrals internally and externally. A lot of times it's women who are fleeing domestic violence situations. So a lot of times they're needing assistance getting housed. So a lot of times we are doing like COVA applications to get hotel and motel stays. We have some funding to be able to assist clients with first month's rent and deposits. So a lot of applications and submitting with Flex Fund and the MDHI system, I believe is what it is. And then just doing a lot of safety planning with individuals, kind of what does that look like for them to leave their situation in the safest way possible. A lot of times leaving a domestic violence situation is one of the most dangerous times for clients. So just really being intentional with the plans that we're making and the resources that we're connecting people to, making sure that they're being connected properly and have that support with them.
So someone in the chat asked, how would we refer somebody to you if they were in a situation like that?
So there's different ways to be referred at the coalition. Reaching out directly, and I can provide mine and the other domestic violence coordinators information in the chat. We also have a referral form as well that people can fill out. That's in mine and the other domestic violence's email. That's also just a link that is shared throughout the coalition. So essentially what happens is we get those referrals once you fill out that form. It's like a Google Docs form, I believe. And then it goes into a spreadsheet, and me and the other domestic violence coordinator, her name is Julie Dewey-Graham. We connect with those clients within 48 hours of receiving those referrals. So I think it's important to know that we work with domestic violence clients. Our role is not the same as a crisis worker. So we kind of have, just since we're working with so many clients and there's only two of us having to connect with folks, just that turnaround is shorter than versus like a crisis line where somebody would be connected immediately.
Evan, I have a question. So, are you basically triaging, or do you also have a shelter? Because I know Safe House is a DV shelter.
So we're doing a lot of triaging. So
Okay.
we connecting with different shelters, having connections with different folks in those places. As I mentioned before, I worked in safe houses, so that's kind of nice being able to know some of the advocates, to kind of just know what the back end of that process looks like for clients doing intakes, and what that truly looks like. You know, instead of just getting a phone call like, you know, call back tomorrow, or so that's kind of nice to have those connections with folks. But it's definitely a lot of planning and connecting, and just trying to see what is the best fit and the safest route for that client.
The Delores project is not a DV shelter. When folks call, we do ask if they are fleeing a DV situation currently. Now, having said that, we have had guests who, you know, didn't disclose that and were in a DV situation. But we have a behavioral health therapist on site that really works with our shelter guests and supportive housing residents to do groups to provide therapy, counseling, and that's been quite helpful and instrumental in really getting folks back on track to rebuilding their lives, stability, and feeling safe.
Yeah, I think, oh,
I'm sorry, go ahead, Heather.
I was just gonna say, just to kind of piggyback off of that, I think education is a big piece in connecting with clients, kind of helping them understand what domestic violence is, and kind of the power and control wheel, how that kind of, what that kind of looks like. Bringing that to their perspective, I think can change a lot of people's situations, not understanding that they are in a domestic violence situation. So not necessarily telling them, but to help them understand what these situations are, and you know how that applies to them.
In Ann Carlberg, there is not enough safe houses in Denver for victims of DV. And yes, it is also a factor that contributes to homelessness.
There's been a lot of amazing discussion in the chat. Thank you everyone for engaging there and sharing resources. That's really helpful and exactly what we want to do here. One of the themes that I've seen pop up is around rural services. So I'm wondering if you all can speak to what kind of services are available for women experiencing homelessness outside of the Denver metro area, and maybe where are the gaps?
I'm going to jump in here. This isn't specific to your question you just asked, Aubrey, but I'm monitoring the chat and just wanted to throw out a couple of things if this is helpful for the group as a whole. So I'm seeing a lot of conversation about, not having available beds and kind of what do we do for these folks, where do we send them? And so just to reiterate that we definitely do have space available, specifically at the Women's 48th sheltering location. And there's a couple of different ways to access that. It is a 24-hour operation, which is super helpful. So individuals are able to walk up and access services at any point. And I know we do have beds available there currently. So just to throw that out there for anybody that was questioning how to get in touch, I believe Stephanie Kaufman left her email here in the chat. So she is a wonderful resource for those of you that are curious. And then one other question that I saw asked, what are the resources available for transgendered individuals and how are they being received, within community? And so one piece that I wanted to say from the gathering place perspective is that we do have a 24-hour overnight sheltering operation that we run right now. It is non-congregate, which means you are not in a congregate setting. You're not sharing you're not sharing a big room with individuals. It is your own private space. And so in that, we've been incredibly intentional about making sure that those that identify as transgender or non-binary are getting a space where they feel safe and comfortable, because we do know that there's been a lot of just feelings of unsafety in some of those larger shelters. So definitely encourage, if you do have questions about that, I'm sure our emails will be available at some point down the road. And that does not answer your question about rural resources, Aubrey. I know we have a huge gap in that space, but wanted to address from our home perspective what we have here in Denver.
And the Delores project only operates in the Denver metro area. And by the way, I don't think I mentioned that we are a 50-bed shelter. So a smaller congregate, 2 dorms, bunk bed style.
One resource that I'm familiar with for domestic violence services is called PeaceWorks. And they kind of function out in the Park County area, which is a safe house. They do legal advocacy and yeah, kind of case management for the time periods that they stay there. That would kind of be a resource that I'm familiar with in rural areas, but kind of like Stephanie said, just our services are very much based out of the Denver metro area. So that can definitely be challenging to kind of work with clients, especially if there's issues like transportation or different barriers preventing them from being in the area.
Those are great points. So Alexis brought up an important point in the introduction, is that we really can't talk about sheltering women experiencing homelessness without talking about what happened the last 2 years. So can anyone speak to how operations might have changed during COVID-19 and how stay-at-home orders and other measures may have impacted women?
I wish there was a way where my staff can speak up. There's some on this call, but I alluded to it earlier in that the Delores project was a week-long shelter, overnight shelter, and in the midst of the pandemic, we shifted to 24/7 to be not only to align with the CDC guidelines of social distancing, but also stay at home or stay in place, is that what it is? And that was also a movement that the city and county of Denver, most of the larger shelters, I think all have shifted to 24/7. And I wanted to address something that somebody had asked in the chat about shelters for transgender individuals. And so when I said that we are a shelter for women and self-identified transgender individuals across the spectrum, we really try to create a inclusive, gender affirming shelter based out of respect, dignity, and inclusivity. And so that is in terms of that value is very much part of our shelter participation rules. It's not really rules, but guidelines, not only for folks who are accessing our shelter, but for our staff as well, and really holding everybody accountable to create that inclusive, gender affirming type of environment.
I'll piggyback here as well off of Stephanie. I think the pandemic obviously brought a lot of challenges to many of us as individuals and to our community. But one thing I feel so grateful for is that we really did transition to this 24-hour sheltering model. And so we're really fortunate to see the effects of that on the positive side. We've housed over 70 individuals from our hotel motel style shelter. And definitely think that is not something that would have been possible if, we weren't under some of the pressures because of the COVID-19 pandemic. So saw a lot of grief, but we're coming out on the other side with, I think, a much more effective model than we had previously.
Oh, I'm sorry, Heaven, go ahead.
Okay. I was just going to say just the accessibility to things and kind of just piggybacking off of Stephanie, just how things had to change for staff. So getting creative on our end, but also being able to connect with clients in a way that's safe. I feel like a lot of people have experienced financial hardships, so losing their jobs and not having that income. So again, just the accessibility to different things is not the same as it was before. And then two, just how safe is it to reach out? So like going back to the loss of jobs, what we were seeing was individuals, abusers would be home more frequently because they're not going to work anymore. So having to get creative on safety planning and especially with some of the stay-at-home orders, people weren't physically able to leave or go to a safe place to talk or to make a safety plan to leave. So a lot of getting creative with connecting with people.
And I was going to say, shifting to 24/7 really does allow us to create a robust program, shelter program that offers life skills classes, that offer on-site case management, on-site behavioral health care, and our staff working even more closely with our shelter guests. And Rebecca, congratulations and having the gathering place move 70 folks. And we've also been able to collaborate with other organizations like CCH to really help move, I think in the past year, move about 54 individuals into housing. And with our continued care program, and that is case management that's ongoing for up to 1 year, that's really been instrumental in retaining. We have I think a retention rate of about 91%. So those who have remained in housing 6 months to 1 year after they move out of our shelter into housing, they've remained in housing. So it's been a a lot of changes, but our staff is just so resilient, and also our guests, and they've made it happen.
It certainly sounds like the pandemic has posed a lot of challenges, but also a lot of opportunities as far as rethinking how we offer shelter and, for example, the non-congregate shelter model. So thank you for all you've done to be resilient during this time and use it as an opportunity. I think it's pretty exciting. I'd like to pivot a little bit to an unrelated question to what we've been talking about. But I'm curious, since all of our organizations serve cisgender and transgender women who may have unique needs, that people with uteruses really face some specific challenges when they're experiencing homelessness. So I'm wondering if you all could touch on what are some key considerations around people who may be menstruating.
So here at the Gathering Place, we have every single restroom stocked with all sanitary items. That way you're not having to go to a staff member and engage in that conversation. You can just go into the bathroom and it's all readily available for you, which we found to be really, really effective and helpful, and creates a space of dignity as well.
Yeah, and we have that as well in our shelter. And also, we also stock it with what is the term? Adult diapers. I don't know what you would call it, because it can be embarrassing for guests to have to ask for it. So we have it stocked as well.
We're the same way too. A lot of times when women are fleeing from domestic violence situations, they're not really taking a ton of items with them. So we have a lot of different kind of bags that we can provide for people that come with different hygiene products for them. I think another thing to point out too, just through CCH, through this the Stout Street Health Clinic, they offer pediatric nights for pregnant women. So just having more accessibility to healthcare services through CCH.
I think one other unique concept we have is the gender neutral bathrooms. So we have restrooms at TGP that some are for women. We have one for men, if that's what you identify as, and then one as just a gender neutral. So again, if you're not comfortable identifying as one or the other, you still have access to all of those feminine products without having to say that out loud, which is something we're really proud of.
Yeah, meeting people where they're at and centering dignity of all people sounds like it's really central to all of your missions. I'm wondering specifically about women who might have disabilities. How do you consider that in the care that you give?
That, Aubrey, thanks for bringing it up, is something that we have been discussing as providers in terms of, we're just not equipped to shelter an individual who has difficulty or unable to do their activities of daily living. And there are times when we have had individuals dropped off directly from the hospital in a wheelchair outside our door, and because they have no place else to go, and we can't leave them out there. So our staff does the best they can, but it is a critical need in our community, not only to have appropriate shelter and appropriate services, but a better triaging with the hospital and law enforcement.
A colleague and I were just having this conversation today, and Stephanie, I couldn't agree with you more. Like, this has been really the core challenge amongst our community for a very, very long time. And all of us as providers are struggling with how to best support these folks. And I think we're still searching for that answer. And I wish I had something different to share with you today, Aubrey, but I am forever optimistic and hopeful that we continue to explore, and we're one step closer every day.
I would just kind of echo what both Stephanie and Rebecca are saying. I think we do our best to try and accommodate the needs of the client based on what we're equipped with. And I think one thing or one resource that we kind of connect survivors to is the initiative. That's a resource for clients that have disabilities and are experiencing domestic violence. So that's one resource that we utilize.
And then what do they do? I've never heard of them.
It's kind of like case management or advocacy would be, I would say, that is their role. So just a lot of advocacy and connecting to resources, just having more of a personal or specific lens to those backgrounds and being able to connect. But I would say, just as you two said, just really trying to do our best to work with the circumstances and the situation and giving the best support that we know how.
You just sparked something in my brain there, Heaven. We are connected to the Colorado Fund for People with Disabilities. They're not able to actually come on site at this time, but we do have that connection to make referrals. And so that allows you to work with a case manager on an ongoing basis to tap into some of those available resources in the community.
On this optimistic and forward-thinking note, I'm going to ask my favorite question, and then we'll open it up to more widely to what's happening in the chat. And also my cat has joined us. But if each of you had a magic wand, infinite resources, what would you do to help solve homelessness for women?
I will start with this one, if that is okay. I could talk about this for, for quite some time. I think two things would be my primary focus. One is more affordable housing. So we all know that as the rent increase rises and our wages kind of stay the same, it really limits our options for getting people plugged into something that they can sustain. So that would be number one, is creating more long-term affordable housing units. And then number two would be establishing more of our non-congregate shelters. I saw a little plug in the chat there about that as well. And I think, again, there's something really, really dignified and special about giving someone their own individual living space. And it prompts them to kind of craft a future for themselves where they can even envision, what does this look like for me to have a place to call home? And what do I need to do to make that happen? And I think even being able to get them in the space and get them in that frame of thought, and then provide them with the wraparound case management and supportive services to make that dream a reality, allows them to bridge the gap from, houselessness to housed. So those would be my two things.
I'll go next. And this kind of answers a question that somebody had about, did you have staffing issues, shortages? And of course, yes, as if you can imagine, all 9 of the, I know there's more, but at least 9 of the shelters who have moved to 24/7 and needed extra staff to support that. But if I had a magic wand, I would give staff higher pay. We are in the business of housing people and ending homelessness, and to have staff who struggle financially to make ends meet, to find appropriate housing themselves, that's an injustice. So I would love to pay them more. And Rebecca, you had mentioned, yes, more affordable housing. I want to attach funds for support services attached to that, because there's a lot of affordable housing, supportive housing that's being developed or in the works, but not enough money, funds attached to provide the necessary wraparound support services to make sure that folks remain housed. So if I had all the money in the world, I would do those two things and more, but just.
I would agree too, just having more funding for things, whether that be to have more shelters for people to go to have more properties for people to live in, and then to just more staff to be able to support people. I think a big part of this journey for people is just empowering them to be self-sufficient and to be independent. So really just having more of that training for people to give support in that way versus just doing things for clients. But yeah, just more, and then just more appreciation for the staff that connect with folks, and making sure that they have the support that they need to support clients.
Thank you. I know that it's a challenging question. It's so broad in scope. We've got a ton of questions pouring into the chat. So if you see any that you would want to speak to, feel free to jump in. But on the point of non-congregate sheltering, sounds like that's a real theme here. And one of the best ways to help support women who are experiencing homelessness in that transition. What is the likelihood that there will be more of a move towards non-congregate sheltering? And will there be funding? Do you expect there to be funding to support that? Is one of the questions here in the chat.
I will jump in and speak to that. I think in short, the answer is yes. I mean, again, we've seen that this model is incredibly effective and truly provides that bridge between unsheltered homelessness and housing. So yes, to what extent, I don't know the funding specific to that, but I know we're already making strides as a whole to ensure that this model maintains some sort of its structure well beyond just the pandemic response.
We do not operate the non-congregate shelters, but I would imagine that security and funding for security is going to be critical in non-congregate motel type structured shelter, right, Rebecca?
We could talk about that for a whole hours in and of itself, but yes.
I'll jump in with one that I saw. Tom Olshner says, our church is probably going to open up a safe lot with Colorado Safe Parking Initiative as we structure our program. Do you have any recommendations on how we can be responsive to the needs of women?
So my immediate, and I am not an expert in safe outdoor spaces and parking. I forgot what the terminology is, but you just mentioned, Alexis. But I just thought, as you said that, I was thinking, would that parking lot be fenced or not? I'm just thinking that might be something to consider.
I wonder too, and I'm sure, and Aubrey, correct me if I'm wrong here, but if there's potential for us to connect after this educational series, and maybe we can dump some resources at you to disseminate to the group. I'd love to connect with maybe some point people that are familiar with operating those safe outdoor spaces, and I'm sure they would just hold a wealth of knowledge.
Absolutely, we'll definitely share those resources around. Another question I see here, or a comment, is I wish members of our community understood homelessness. Volunteers and navigators are needed. So I've got a two-part question related to this. First of all, how can we change attitudes in community around homelessness or women experiencing homelessness more narrowly? And then how can people get involved if they want to help?
I think just a big piece is just education. So kind of helping people to understand um, homelessness and how people are become homeless, I think is a big piece of it. I would say to kind of get involved is to even just be to start learning about different aspects of homelessness and just what is available to people. I recently started working at CCH in November, and I mentioned that a lot of my background is in domestic violence. So even just coming to the coalition, I feel like I learned a lot about homelessness and how there are different barriers to people and just the accessibility to things that that I never really thought about before. So just kind of understanding what that looks like. And then I think just kind of giving back in whatever way that you can. Sometimes for people, it's being able to go out and volunteer and physically serve people. Sometimes it's financially being able to give to programs and funding, I think would be my thoughts on.
I have to, oh, I'm sorry, Becca. Go ahead.
No, you go ahead, Stephanie.
Okay, I was gonna say, I like what Heaven said, education, 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 just being willing to listen, 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 and learn. We have a fantastic group of volunteers who also act as advocates, not only advocates for the Delores Project, but really advocates for individuals experiencing homelessness and advocating for housing solutions. And so it has a domino effect, ripple effect of really increasing awareness. We also need volunteers. I think Stephanie JW might be on, my volunteer manager. We need volunteers, as since we have moved from overnight to 24/7. We have a lot of meal slots and holes, and so needing volunteers to provide meals or cook meals, and they can you all can easily get on our website, and there's a little link for volunteers.
And I'll echo here what these two wonderful individuals mentioned, but I think it's really engaging in challenging conversations within our own communities. So if you're in the car with a family member or a friend and they have this preconceived notion about one of our unhoused neighbors, it's speaking up and saying something. And sometimes that can be really tricky, right? But I think it takes all of us to help rewrite the narrative around that. And I know my team, a lot of which are on here as well tonight with us, just do such an incredible job about always reminding, if it's a volunteer, whomever, a partner we're engaged with, to use proper pronouns and just be really respectful of everyone's space and how they wish to identify. So I think all of those things combined together is how we shift the story around our unhoused. And then we are always looking for volunteers as well. So we have a lovely link on our website if you are interested in getting involved in that capacity.
I'll jump in with another question. Randall Loeb asked, how do you see the issue of trauma and people who have children in their lives? How is there an understanding of generation to generation trauma? Maybe I'll throw that to Stephanie, because you sort of started off talking about trauma-informed care at the beginning.
Thanks, Alexis. Breaking the cycle of trauma and poverty. My former profession I was a therapist, and so trauma-informed care to me, for those who may be unfamiliar with the terminology, to me it means recognizing that everybody who walks through our doors, guests, residents, and staff, have experienced something in their lives that has been traumatic for them. And it impacts, it informs how they see the world around them, how they see themselves. And it could be a direct experience, it could be vicarious, it could be structural racism. I mean, we could talk about that too, but so all of that impacts how their lives. And having, in our behavioral health care, we wanted to have behavioral health care in our programming to address the challenging and difficult conversations that our guests really hold on to and don't share at times, because that's putting themselves in a vulnerable situation. But I think just for us, having somebody that our guests and residents can turn to at whatever time to talk about some of those challenging issues, because that is part of healing. That is part of the pathway towards stability and towards rebuilding their lives. I don't know if I answered that question. It's just such a complicated topic.
One thing there I'd like to just to mention is I think something really important for us to remember is that all it takes is one person to stop that generational trauma. So when you break that link for one person, that really eliminates it from spreading down the chain of families. And so treating every guest as their own unique person and really thinking through how can we get them, Stephanie mentioned it and said it really well, but getting them the appropriate supports needed to really to help heal whatever that trauma is that they're carrying, and keeping that person-centered focused lens and not kind of categorizing them, but treating them as an individual that's experienced their own unique trauma, and how do we respond with a unique practice and support system to treat that effectively.
Yeah, I would.
I'm gonna, oh, sorry, go ahead.
No, if we need to move on, that's okay. I was just gonna say, just like an issue that I've seen with trauma and clients is sometimes clients don't even recognize that they've been through something traumatic, and that if they have children, that kind of can affect the family unit. Because they've all experienced this traumatic event and it looks differently for them. So kind of just like Rebecca was saying, finding a way to be able to support each one of them as individuals, even though they've potentially experienced the same event, and not looking at it that they're all experiencing the same thing or feeling the same thing about the same event.
I just want to, Alexis, I'm sorry, I just want to address the question that's in the Q&A. Somebody wrote, how are terminally diagnosed women provided for as they approach death? There is, Sherry, there is a new program called, I think it's Lazarus Health. I wish I had the new link, but they provide respite care and shelter housing for those who are approaching the end and terminally diagnosed individuals, which also leads me to another point that we need. There's a gap in our community, is appropriate housing for older individuals experiencing homelessness, 55 and up. There's a huge lack of appropriate housing for them.
Thank you, Stephanie. And I just want to acknowledge we have so many amazing questions in both the Q&A and chat, and we're not going to get to all of them. We're scheduled to go to 6:15. We're happy to go a little over, but I know we're not going to get to all of them, but we're doing our best to pick some out. I have one that maybe I'll put you on the spot for, Aubrey. I know you're our moderator, but you are also our sort of public policy expert. And we had a question from Kate Stigberg that says, are there specific public policy solutions, rezoning, access to resources, or more funding that could help address the inequities women face? And if that's not an attainable answer at this time, are there efforts that organizations or individuals do to lift up the experience of women experiencing homelessness?
Yeah, that's a great question. So speaking to the needs that our panelists identified around specifically affordable housing, additional shelter resources, and wraparound services to make sure that people remain housed successfully. Right now, the state legislature is working on allocating about $400 million of American Rescue Plan Act dollars from the federal level for some of those needs. And so that's something that you all can engage in, and you can follow that process as it moves through the legislature, and you can influence that. So I'll put a plug in for our upcoming coffee chat on our kind of a mid-legislative session update, and that's going to be on Tuesday, March 29th from 5 to 6 p.m. And we'll be sure to send out that information so you can stay up to date on all of the policies that impact people experiencing homelessness or at risk of homelessness. And I'll also say that we've been engaged in a lot of work around equal pay legislation in the past, around reforming landlord-tenant laws to help keep people from being evicted and give them the resources they need to stay housed, which all impact women in particular, as we heard tonight. And then another bill that you can follow, this is a big, huge answer, but another bill that you can follow is House Bill 1259, and this will essentially double the Colorado Works cash benefit to families who are living at a very low income level. So that really largely impacts and assists moms with kiddos. So please do get engaged, and we want to give you the tools to do that. And so at this point, I think maybe Alexis, should I turn it back to you so you can close us out?
Yep, that sounds good. So Ryan, if you could just throw up the final couple slides for our presentation. Thank you all so much for attending. This chat conversation was amazing. We will download that and go through it and be sure to understand what's some of the additional questions. And we hope, I mean, there's so many experts in this room that it was amazing to see some of you answer each other's questions and connect. I know we had a lot of experts here today and not all of them were on our panel. So thank you all so much. Please keep an eye on the chat for more information. And if you want to get involved, we had a couple of links in the chat for the Delores Project and the Gathering Place for how you can volunteer at those organizations. Here at CCH, you saw the link from Heaven on how folks can be part of how you can fill out the form if you have someone who's experiencing domestic violence, who needs some assistance. And then we also want to encourage you to visit coloradocoalition.org/advocate. You can find out about how we're impacting legislation. We can get on our list, and it'll basically send you those notices that tell you, hey, this is how you contact your legislator and ask them to vote a certain way. And we really keep track of so many bills because we know that homelessness is caused by a lot of different factors. So about a quarter of the bills that go through the Colorado legislature, we're tracking in some way and have pros and cons on in some way. So if you join our advocacy network list, you really get caught up on everything, and you can impact your legislators by filling that out. So those are all there. We also visit us online at Colorado Coalition. You'll see that handle works on our YouTube, in addition to all the social media sites. And we put up old education sessions up there. So if you miss one of these, you can always go back and check it out. And then finally, Ryan, if you'll go to the next one, we have our next session in April. So we've announced some of our upcoming sessions. We're going to do 8 in 2022. They'll be on the third Thursday of the month from now on, but we'll be skipping July and December, but every other month they'll be happening. Please join us live and be part of the amazing conversation, or you can always watch them the day after on YouTube. The next one's going to be on public benefits and homelessness, how to connect and increase funding. It's on Thursday, April 21st. And that one will be a little bit more educational and a little less free flowing, but we're excited about it. And then, as we mentioned, tomorrow, we're going to put this on YouTube, and we will send everyone an email. In that email, you'll get these slides. You'll receive the link. I'll check in with our panelists if they're okay with their email address being included, or you'll at least get the contact information for their organizations. And hopefully we can continue the conversation as this goes. So thank you all so much for joining us. I'm sorry we didn't get to all your questions, but please join us for the next one and we'll continue the conversation. Thank you.
Thank you,
Thank you so
everybody.